This is Exploring the Impact of Wavelength and Spectroscopy-Based Blood Glucose Monitoring by Thacine Kazi and John Oakley from the Departments of Computer Science and IT. Diabetes and metabolic diseases are some of the most crucial health issues of the 21st century, and monitoring blood glucose levels is the leading indicator of these diseases, making it crucial for healthcare. However, current measuring methods involve a constant process of drawing blood or using subcutaneous needles. This process is costly, often painful, and not patient-friendly. An emerging solution is using spectroscopy, which involves the emission of light and capturing patient data with cameras. Having a device that can quickly measure blood glucose values while remaining reusable, cost-effective, and non-invasive is the next step in improving patient care.
One of the most important factors in spectroscopy is the wavelength of the light, which can change the data drastically. In this research, we investigate the impact from 4 different wavelengths of infrared lasers ranging from 650 to 850 nanometers. Using the team's non-invasive device, which utilizes a 3D printed housing and camera, each of these lasers will be tested. As for the data collection process, first the patient's blood is drawn from the left index finger and glucose values given via glucometer. Then, the right index finger is inserted into the box, resting the tip or the belly of the finger onto the camera. A laser is then inserted and the data collection program is started. After taking 50 photos per wavelength, the collection model calculates the glucose value based off of the pictures. Then, the patient's skin, color, age, and sex are recorded. For the data collection demographics, we collected the data using 25 different participants, making up of 11 females and 14 males, with 30 sets total, with values ranging from 78 milligrams per deciliter to 165 milligrams per deciliter.
Overall, after the models were trained and tested, we compared their performance through 2 key metrics: mean absolute error, which represents the statistical accuracy of the models, and Clark error grid, which represents the clinical accuracy of the models. Just a note, Clark error grid, or CEG for short, is a clinical accuracy metric made specifically for blood glucose monitoring devices. Overall, the 2 best performing models were the highest and the lowest, the 850 nanometer and the 650 nanometer, with the 808 nanometer and the 830 nanometer performing just in between. Overall, the summary statistics, like the standard deviation and correlation coefficients, show no clear relationship between wavelength and performance in either of the metrics. Due to the negative relationship between one metric, MAE and wavelength, and the slight positive relationship between the other, wavelength and CEG, we can't make a clear conclusion on whether wavelength truly improves the performance of the model. However, it should be noted that our study did use a short range for wavelengths, only 650 to 850 nanometers. This is not a large enough wavelength range to make clear conclusions, as many blood glucose monitoring devices and others in the field use much larger wavelength ranges, such as 650 to 1100 nanometers. Due to this, we hope to conduct a future study in which we use a much larger range, more samples, and therefore get a much clearer conclusion on the relationship between wavelength and performance. Thank you.